Hello, and welcome to Talk to Downtown. My name is Courtney Wood. I'm the Economic Development Director for the Downtown Stockton Alliance, which is a 501c6 nonprofit property-based business improvement district serving downtown Stockton. This webinar series is intended to connect our business owners, property owners, visitors, and residents with the organizations, people, and resources who can help them address issues which are of top concern to them. Today, we have special guest, Tamisha Allen. She is the Program Supervisor for 211 San Joaquin County. And we will begin by having Tamisha share a little bit about herself and her role with 211 San Joaquin. Then I will go ahead and ask my list of questions I've outlined for her. And at the end, we will go ahead and open it up for the viewers to go ahead and ask your questions. So if you do have a question, be sure to type it in as a comment and we will ask it at the end. And with that, welcome, Tamisha. Thank you so much for being our guest today. I'm very excited to share with everyone what 211 San Joaquin does, what kinds of resources are available through this program, and to meet you. So welcome, and tell us a little bit about yourself and your role with 211 San Joaquin.
Thank you for Courtney for inviting me and having me. I appreciate it. My name is Tamisha Allen, and I am the 211 Program Supervisor. I oversee the 211 department and provide support to the staff in the 211 call center. This upcoming July will be my third year with Family Resource and Referral. I've been with 211 for 3 years. The first year, I started off as a community resource specialist where I answered phones myself. These last 2 years, I became the 211 Program Supervisor. I've taken on that lead to oversee the call center and make sure we provide the resources for San Joaquin residents.
Amazing, amazing. So welcome, and it sounds like you kind of got started with the boots on the ground, so to speak, doing the receiving the calls yourself, and now you manage the program. So can you tell us now a little bit, like, what exactly is the 211 San Joaquin program?
So 211, we are a free and confidential phone line with the sole purpose of improving access to health, human services, and disaster response services. 211 is available 24/7 in over 200 languages. I do have a few call specialists that do speak Spanish and English. Anything outside of those languages, we do use a language line to further assist our callers that speak any other languages. Calls to 211 from anywhere in the county are answered by our trained community resource specialists to assess the caller needs, determine their options, make referrals, provide support, and advocate for the caller where necessary.
Amazing. Okay. And so if you had to kind of describe in your own words what the overarching goal of 211 San Joaquin is, what would that be?
Our overall goal for 211 is to reduce the frustration for our residents. We want to make it easy for our residents to get connected with the resources that they're in need of. So just making that one call or that one text or sending in that one email, providing us with the information that you're looking for as far as what type of services, us getting that information and doing a thorough search within our iCare database and being able to provide that information to you. We want to make sure our residents are aware of what's out there. We want to make sure that they have the information. We want to make sure that they know that they're not alone so that they can always count on 211. So that is the reason that we are available 24/7. We are confidential and we are free.
Amazing, amazing. And can you tell me a little bit about how did the concept for 211 San Joaquin come about and how is the program funded?
So years ago, back in 2014, San Joaquin was the most populated without a 211. Our senator and stakeholders felt that there was a need to have 211 within our county. So Family Resource and Referral was already involved with providing resources and childcare. So they were asked to be involved in bringing 211 to San Joaquin County because 211 was already established in other counties prior to 2014. We had people calling in, looking for resources, so it kind of just made sense. So the project fully started to roll out in 2015. 211 is national and international branded, so there are 43 counties that have 211 out of 58 in the state of California.
Wow.
With 211, with the help of our funders, we are able to assist callers and provide resources. We're funded by local government, grants, and other foundations since we are nonprofit.
Amazing. Okay. So starting around 2014, so not hasn't been around for too long. It's kind of a fresh resource for our community. I love that. And we're talking about connecting people with resources. Can you kind of give a summary of what types of resources you guys are able to connect people with, maybe the categories?
Yeah, so anything pertaining to housing, human service needs, medical counseling. We also assist with those that are in need of rent assistance, utility assistance, anything pertaining to health, human social service needs that are non-emergency. We are able to search our database and provide those resources. Some of these resources do have eligibility requirements or provide require documentation. Some are free of charge, some are based off insurance, some are based off your zip code, such as like the food pantries. So we do assess the callers by asking them a few different questions. So that way, when we do a search, we're able to refer them to an agency that can provide the service and that they're eligible for it if there is eligibility requirements.
Okay, great. So tell me a little bit more about how people can access 211's resources. Is it just as simple as calling 211? Tell me a little bit about the process.
No, so 211, you can access us by, as long as you're within San Joaquin County, you can dial 211 so you get 211 San Joaquin. Since there are other there are other 211s, depending on the area that you're in, if you're outside of San Joaquin County, you may pick up on another 211. So with that being said, is say if you're in Sacramento, but you're trying to get resources within San Joaquin, or if you're in the Bay Area or Stanislaus, whatever part that's not within San Joaquin, you can dial our toll-free number by dialing 800-436-9997, or you can text us by texting your zip code to 898-211. We also have our email, which is 211f@frcsj.org. Once you send in those emails or your text or call us, our specialist would do the same thing, get as much information so we can do a thorough search, provide resources from our iCarol database to further assess the caller. We also have a 211sj.org, which is our website. So at your own tip of your own fingers, you can go on our website at your own convenience and search for resources throughout San Joaquin County. You can change the language on the information on our website in case you read a different language. You can also create an account to where you can save these resources to where you can go back and look at the information. You can make a PDF file to where you can email it or print the information off as well. So the information is there and we're always available.
Amazing. Okay, so you guys are very responsive, whether it's through the phone, phone call, texting, email, website. I love that. And is it true, can anyone access 211, 211's resources?
211 is open to anyone. So like I said, if you're not within our county and you're looking for resources within another county, we can refer you to their toll-free number as well. So if you're not sure where to go or who to call, dialing 211 and getting connected with the community resource specialist would be the best way to go. So that way we can get you the answers or get you connected with the service that you're in need of.
Amazing. Okay, so it's kind of like diagnostics. Maybe someone's calling, they're saying, I have this issue. You guys know that you have a couple of programs that might help them. And then would you guys be asking a little bit of some clarifying questions about eligibility to see which programs would be the best fit?
Yes. So depending on, some people call in and they're just like, I need help. So we, assess them as much as we can, get as much information. Some programs, depending on what it is, like, for example, we have our ACE Rail program where it is for individuals that are low income. So there is some information about your income, whether or not you're on any of the state programs that are for low income individuals to determine whether or not you're approved for the ACE Rail program. And what that program does is give low-income residents a discounted ACE Rail train ticket at a lower rate than what they normally would charge. So we do have to ask information about that. Same thing with the rent assistance is based off income. Low-income housing is based off income. We also are partner with Central Valley Low Income Housing to where we're helping with the coordinated entry to where 211 is the point of contact for the coordinated entry. So individuals that are experiencing homelessness and living in a place that are not meant for human habitat, call into 211. there is a series of a lot of different questions to understand their vulnerability, understand their situation, and to see if they are actually experiencing homelessness, to see if they are vulnerable and eligible for the program. So depending on the program, there may be an intense series of different questions. If it's a basic community center or food pantry, we might just ask you for your zip code just to see what area you're in, to narrow it down and get you something closest to your home. So each resource does have a different type of a series of questions to ask to see if that person is fit and eligible for the program.
All right. And do you have any kind of data about the number of people you connect with resources, like on average each year?
Yeah, so with the pandemic, So with the pandemic, our call volume did increase. Back prior to the pandemic, we were averaging about, in 2018, 11,673 calls.
Wow.
2019, our call volume was 12,950. Once the pandemic occurred, our volume jumped dramatically. In 2020, our call volume was 60,720.
Oh my goodness.
And then this past 2021, we received 159,937 calls. So with that being said, 211 has grown a lot. Our database has grown as well. Prior to the pandemic, we had about 3,000, maybe 3,500 resources. Now we're at about 5,000. So we're getting a lot of community partners joining our database. To be a partner, you would just go on to 211sj.org and click on our partners tab, and you would fill out an application. As long as you meet our inclusive or exclusive criteria, which is AIR state certified guidelines to make sure that it's a government or local agency that meet the criteria to be a part of 211. With that being said, if they meet that criteria, we will add them to our database to where not only can we see it on our end, but if you go onto our website and search on your own, you would be able to see that same information in regards to the description of the program, the agency, the hours, the location, the documents, the eligibility, and all the information you would need to know to see like if you are actually eligible for the program if you were looking on your own.
Amazing. That is such a huge jump. Oh my goodness. Like, I'm sure you've needed extra staff to help support the volume of calls. To
be honest, my staff knocked it out on their own.
Wow.
It's a lot of call volume. I pitched in myself. So, you know, we make it happen. We're here to support our community and make sure we're answering the calls, text messages, emails, and doing what we need to do to provide the services to our community. This information is previewed as well on our website. So at the end of the year, every annual, we put our annual reports on our website. So you individuals can see the type of resources that we provided, the zip codes that we serve, the age group, also the type of resources that were provided as well. And you can see the call volume. You also can see our text volume as well, because it kind of tells you how many subscribers we have. So you can see a lot of information. Our information is not hidden from the public. We do share that so people can see the impact that 211 does have on San Joaquin County, since we are the center hub for resources.
Thank you for all the work that you've been doing. That is truly amazing.
Thank you.
Yes. And so with that volume of calls that you described, what type of assistance do you think was like the most requested?
Well, in the beginning, everyone wanted information about COVID guidelines, test sites, vaccination sites. Before my turn came into place from the state, 211 actually was assisting with public health calls to where we answered public health, their guidelines, providing information as far as, what was closed, if you had to wear a mask, not wear a mask, what the guidelines were for restaurants and any other businesses. Business owners will call in as well, getting information, what can they do, what can't they do. They also called in for test sites. We did the vaccine registration as far as scheduled the appointments as well. So at that point, besides COVID related, it was rent assistance, food pantries, mental health. A lot of individuals was experiencing mental health during the pandemic, people losing their jobs. losing their loved ones. Childcare still was a big play. With the pandemic, some schools were closed to where people still had to work to where they needed childcare, but they still needed their kids to do the distant learning, but they needed their kids to have a place to go. There was electric bill assistance, as well as assistance with water, anything really pertaining to people housing needs to keep their lights on, their water, keep a roof over their head, as well as make sure they have food for their families, because individuals were either were waiting on unemployment or didn't get approved by unemployment, or they lost their job and or their hours got reduced to where they were affected financially by the pandemic.
Wow. So quite a plethora of topics that you're kind of helping people to connect with resources that they were needing, essential resources in a lot of cases. Very, very interesting. So I kind of want to ask, is there any resource in your directory that you think people listening might be surprised to know that even exists?
I would say it would be our tobacco cessation. We are partnered with Kick It California. With Kick It California, individuals who smoke or vape and looking to stop doing so can actually call into 211 and sign up for the program. Once they sign up for the program, they do get a $20 gift card. You do have to be 18 years or older to sign up for the program. Besides that, I would say also, like I was mentioning in the beginning, our ACE Rail program, where individuals that are low income can get a discount train ticket. It could be anywhere. You don't even have to be a San Joaquin resident. You can reside in Stanislaus or Sacramento, but as long as you're trying to travel to the Bay Area, you would be able to qualify for that program by calling into 211 and just doing the eligibility assessment. Also the program with Central Valley Low Income Housing with the coordinated entry as far as helping individuals that are experiencing homelessness with finding permanent housing. We also are partnered with PG&E to provide care coordination. So anyone that's a PG&E customer that received their electric services through PG&E, they can, when they call into 211, we assess the callers and we ask them, if they received their electric from PG&E and if they're prepared for an emergency power shutoff. With that being said, is PG&E cuts off your power for more than a few hours or a few days, and it can last for some time to where you wouldn't be able to survive without electricity, and you're not really prepared. We have a care coordinator that will help with a safety plan. Not only will she help with a safety plan, but also provide resources to assist with those times as far as shelters, food pantries. She also makes sure that you're signed up for the care program if you qualify, if you're a low income resident, to receive a discounted rate on your electric bill. If you have medical equipment, you may be qualified for the medical baseline program with PG&E. So our care coordinator basically coordinates with the callers and make sure they are aware of those programs, provide them with the information so they can sign up, as well as with a safety plan to prepare them for an emergency evacuation in case there is a power shutoff that they're affected for more than a few hours or days. So I would say those are the main programs that a lot of people don't know that we are partnered with and that we assist with as far as signing you up. So definitely always reach out to 211 because there's always new programs and there's always information that a lot of people aren't aware that's out there.
Amazing. Thank you for sharing those resources. So now I want to ask, how many of the resources that are within your network are located within downtown Stockton, out of curiosity?
I want to say we have about 4,000 resources within the zip code area of the downtown area.
That's amazing. 400. Oh, okay. I was going to say, whoa, but that's still a lot. 400 is still that kind of makes us sort of a resource hub. I know that we are for, certain services that are needed by people who are homeless, people who might be in the low income category. So that makes a lot of sense to me. Very interesting. And are there any resources specific to downtown residents, property owners, or visitors?
Not necessarily. Like I said, each program has their own eligibility criteria. Some are based off zip codes, more so like the community centers, in the food pantry, sometimes just depending on the food pantry. But for the most part, our specialists assess the caller to, see what they are eligible for, and
Mhm.
see if they are, what criteria the program has. So for the most part, it's not necessarily just excluded to certain areas or certain population. It's more so based off income or insurance, or it's free of charge in general.
Okay, so just mostly countywide, but with certain qualifications or eligibility requirements. All right. And so for you personally, what is the most common question that you get asked about 211 San Joaquin?
A lot of people ask how come 211 does not provide any direct services. So
Hmm.
unfortunately, 211 is an information referral line where we just help and provide callers with resources and assist them where we can. Our staff do advocate where needed, but when I think of 211, I try to explain it more so back when they had the 411 directory. That's kind of like what 211 is, but it's more so for health and human and social services versus for everything. So sometimes we do get callers that call in and say, hey, can I have the number for McDonald's? And unfortunately, that's not a number that we would have in our iCare database, but depending on the circumstances and the situation, we do courtesy searches for our seniors and those that are not have computer access or really know how to find the information. But 211 is mainly to help with health and human services.
Okay, thank you for sharing about that question and for kind of clarifying that for us. And you kind of, I think, mentioned something related to this earlier, but how does your organization decide which resources to include in your network?
So to help determine what programs or resources are eligible for our database, we establish a guideline for inclusive and exclusive from our 211 San Joaquin database, following the AIR standards. An agency must meet the criteria in order to be considered to be in our database. So our senior data analyst will review the application and add the agency and program if they are eligible. Once they are added, she would normally send a courtesy email saying, thank you for wanting to be a community partner. Your information has been added to our database. You can go onto our website and preview it as well. So that way they know and they can refer their clients, or if they want to, just go in there and see what the information looks like. We do ask our partners, if you make any changes with your program, to reach out to us. We do send out annual verifications, but if anything changes before our annual verifications, we do like our partners to reach out to us, so that way we can make sure that the information in our database is up to date. So the information that we are providing our callers are up to date and correct.
Okay. Would you say primarily the resources that are within your network, they're coming from nonprofits, they're coming from the government? Are they ever coming from a for-profit entity, just out of curiosity?
For the most part, they are nonprofit and government and faith-based organizations, and then schools as well.
Awesome. All right. Okay, so from your perspective, you've been working here for 3 years, you've seen a lot of calls, you've heard about the needs from the community. I'm curious, do you think that there are any resource gaps within San Joaquin County? Like, is there something that people constantly ask about, but we don't really have the resource to help them yet?
There's always sometimes a gap. What we normally do is, if for any reason we don't have that information within our database, normally if we collect the information on our iCarol, when we run a report, we can see the needs that were not met. So we would normally share that information with our stakeholders, so that way if funding does come available for the county, that we can see if that program can be implemented. Like for the longest, there was no water assistance for
Wow.
those that needed assistance with their water bill. Now there actually is a water program that helps individuals with their water bill, similar to getting help with their electric bill. So, sometimes it does take time for the program to roll out because it is always based off funding. But we do collect information in regards to programs that we were not able to refer callers to, so we can, when we do our annual reports, we can share that information with our stakeholders.
That's great. That's great that you can track it. At least you have the information. You know, maybe you had 100 requests for this service, so you have that moving forward, so that other organizations know maybe how they could expand their services to meet needs. I love that. Okay. Now, can you tell us about any new resources or anything interesting that was maybe added within the last year?
More so those programs that I just mentioned in regards to the coordinated entry and the care coordination with PG&E. Those two programs were just recently added this past year. We've been in partner with Kick It California for years now. So that's always been around. We've been with Ace Rail as far as partner with them for some times. You know, and since we are underneath Family Resource and Referral, we do promote a lot of the First Five programs. So individuals that have children 5 or younger, we do refer them to a lot of programs that can help with their developmental, social, and emotional skills, as well as children from birth up until the age of 18 may qualify for the SJT program. So we do promote those programs when we do screen our callers if they say that they have children within those age groups. Some people are not aware of Help Me Grow or SJT or home visitation, a lot of the programs that are for First Five for children within the 0 to 5 age group. So we try and make sure that, you know, based off the information you provide to us when you call into 211, even if it's a program that you're not in need of, we still may mention it on the call and see if you may want to take the information.
Awesome. Just to spread awareness, make people aware of what's available to them. I love that. Okay. From your perspective, again, what are the biggest opportunities and challenges for 211 San Joaquin today?
I would say currently 211, we are working on a app for both iPhone and Androids. We're trying to bring this to our customers in the upcoming month for everyone to have access to the 211 resource app with their fingerprint. So our challenge is to streamline our funding to roll this out in 211 instead of having multiple different funders. We want to try and do it with the 211 funding. That way, not only do individuals have to go onto our 211 website, but they can actually just go onto the 211 app and the information would just be right there to where, you know, there's no barriers and they wouldn't feel as though they're not getting the information that they're in need of, or, you know, some people don't feel comfortable with calling and asking for help. So having that information at the tip of their fingers would eliminate some of the challenges and opportunities that we do have.
That's amazing. And you said that's rolling out this month?
Not this month. That's something that we're working on. So in the upcoming months, so hopefully before the new year, but we don't really have a specific launch date.
Still, that's going to be an amazing tool for anyone trying to keep track of all the resources that they want to access or they have accessed in the past. I love that. Amazing.
Definitely.
So in your own words, what makes 211 San Joaquin so valuable to the residents of our community?
I feel like 211 is valuable because not only are myself and our call specialist residents of San Joaquin ourselves, but we have the information. We're here to advocate and assess and make sure our callers are getting the help that they need. So knowing that you're talking to someone that's actually a live specialist and actually in the city or county that you live in, to where we know the landmarks, we can relate, we know the culture, we know the programs. I feel like that gives a big complete circle for everything, to where the culture is there and the connection is there, and we can actually build that rapport with our callers.
So there are local people on the line ready to help you. I love that. Okay, so I just have a few more questions before we open it up for viewer questions. I want to ask, how can the community help? Like, how can they contribute to the work that you're doing?
Well, you can become a 211 champion and donate to our program. You can also become a partner and add to our database, so that way we have resources within our county to share to the individuals that are in need of services. So you can always go onto our website. There's the donation information on there, calling into 211, figuring out how you can become a partner, or going onto our website, completing the application. Just doing your part and making sure, you know, you help promote 211 as well. contribute. We have social media as far as Instagram, Facebook, and Twitter, tagging 211, following us, giving us a call, just, looking for services is always going to help as well, because without our callers, 211 wouldn't be here.
Wow.
You guys are the reason that we're here. We're here to help, but without the calls, 211 wouldn't be needed if there wasn't any calls that came.
True. And do you have any way that people could maybe volunteer at all?
Right now, with the pandemic, we do welcome volunteers, but with the pandemic, we kind of been holding off on accepting volunteers, just because of all the different changes and everything that's been going on with the pandemic. At this time, we haven't really taken any volunteer services, but anyone that's interested, you can always send in your information. We can always keep that information. If anything changes, we'll then reach out and proceed and see what we can do to get you in and trained and become a volunteer.
Okay, so not at the moment, but maybe upcoming opportunities available. Thank you. Okay, so you kind of just touched on how they can follow you guys on your social media platforms, how they can call you if they're needing services. How else can people get in touch with you, just if they have further questions about 211 San Joaquin County, or just want to learn more about the program?
Yeah, so they can, like I said, call us by dialing 211 or toll-free 800-436-9997. You can also email us at 211sj@frrcsj.org, or you can also go onto our website. Once you go onto our website, you can submit an application as far as being a partner, to where if you want to learn more and get ambassador training on our program as well, you can submit that information and really learn the ins and outs of 211 as well. So we're just at the tip of a finger by dialing, texting, or emailing us. If needed, if you see us on social media and you just have a general question, you can also, shoot us a DM on social media. But when looking for resources, we do ask for individuals to call us or email us or text us directly versus using our social media for assistance.
Perfect. All right. And my very last question for you before we go into the viewer questions is there anything else that you want people to know about 211 San Joaquin, or you think that they should understand about the work that you guys are doing?
I want everyone to know 211 is confidential. We're free. We're available 24/7 in over 200 languages. Anyone can use our services by contacting us by phone, email, text, or visiting our website. If you're a community-based organization and want to be a partner with 211, you can apply by visiting our website at www.211sj.org. And you can also follow us on social media and stay tuned with community updates.
Okay, awesome. Thank you so much, Tamisha, for answering my questions. And yes, we do have a few viewer questions. So this question is from Ronald Veronica. He's asking, can I call 211 for mental health help?
Yes, of course. You can definitely call us for mental health, depending on what type of services you're looking for, as far as if it's an inpatient, outpatient, or just general counseling or hotline. Those are the type of questions we would ask to narrow down what type of services to refer you to or the individual to.
Okay. He has a follow-up question, 2 follow-up questions. Can he text 211? I think you shared that already, but can you remind us about how that would work?
Yeah, you would just text your zip code to 898-211. It is an automatic response back that you do get that just asks, for what type of resources you're in need of, your age, your gender. At that point, one of my community specialists will then actually take over on the text once the message is sent back with that information, and then narrow down, searching for resources and then replying back. I do say that if you know that your need is kind of unique, as far as there's a lot of questions that may need to be asked and there may be a sense of urgency, I would say calling is a little bit better, because you'll have that, conversation back and forth versus with the two-way text. Sometimes there's a little delay, as far as sometimes the individual will text us and then we'll text them back, and then we don't really get a response back from them right away, to where my specialist kind of has, to wait which is no problem, but we want to make sure that that person is getting the information that they need as soon as they text us. So texting or emailing or calling, you could do whichever you prefer.
Perfect. Okay, and then the last follow-up question from Ronald. He's sharing that the last time he got food from a food bank, it was expired. So he's wondering, is there any other place that he might be able to get food that is not expired for low-income families?
Well, I do apologize, Ronald, that you experienced that. Unfortunately, we don't really have no way of knowing as far as what is provided. So we would hope that you wouldn't get food that's expired, but do take in consideration that a lot of this stuff is donated to the emergency food bank, so they are doing their best to serve the community. Right now, as far as box of food, it is more so with the emergency food banks. Sometimes there is a Salvation Army. Some churches does as well, but those items are still donated as well. Depending on if you are a senior, sometimes Meals on Wheels is another program that we offer individuals, or if you have a disability and you may be eligible, because they do have a eligibility criteria for that program. But there are certain programs that we can refer people to, but for the most part, they are donated items, unfortunately.
Okay, so there's a couple of options outside of food banks. Sounds like Salvation Army and other kind of faith-based organizations. You're saying churches. It is all based on donation though, but that might be some other options outside of the food bank. All right, thank you for your questions, Ronald. I have two questions from Michael Huber. His first question is, he says, hi, Tamisha. If 211 is called in the late night or early morning, are there services or people who will respond to individuals in crisis?
Yes, of course. We're available 24/7. So anytime you call us, whether it's early in the morning, late at night, holiday, weekend, our call specialists are available to answer the calls. If it is a resource, depending on if it's a non-emergency resource, some organizations are only open during certain hours, but for the most part, if it is an emergency, most organizations for like mental health, domestic violence, shelters, they do have an after-hour number. So depending on the program, some of these services are still able to be offered after hours for the programs.
That's great, because you might have a crisis at any time. So it's great to know that there's 24-hour help available. Okay, and Michael's second question is, do the service agencies meet regularly to share information and strategize? If not, he's asking maybe why they don't.
Well, with the pandemic, a lot has changed as far as meeting, but yes, there are meetings amongst the organizations. Not only are there meetings, but there's always outreaches to where everyone always meet amongst each other and share information. Some of these outreaches are only for the agency's staff, to where they can learn about other programs from other agencies, as well as some of the outreaches are for the general population. So the community can learn about these programs as well, and we all can come to one and learn together. And like I mentioned before, I offer a ambassador training as far as for organization staff, so that their staff can learn about 211 and understand the ins and outs and the concept and how to maneuver our website. So that way, when they are dealing with their clients at their office, they can navigate our website and be able to provide resources and assist their clients as well.
All right. Thanks for sharing kind of a little bit about how they might be meeting with each other. And can I ask, what you were just mentioning, the ambassador training, is that free for organizations to access?
Yes, it's free.
Amazing. Okay. So if there are any organizations out there who are serving people who might commonly need resources, it might be a good idea to contact 211 to get a little bit of training in what services are available and how to use those resources. Awesome.
Do a lot of presentations as well as far as other for organizations and the general population. So we do try and make sure individuals are aware of what 211 is, as well as the other organizations throughout the county. They do a lot as well with doing presentations and making sure that individuals are aware about their program and understanding the concept. So that way, when they're in need, they know what direction to go to.
Okay, amazing. I'm looking at the comments section to see if there are any additional questions, and it looks like at the moment that might be all that we have. So in the meantime, I'm going to remind everyone that this video is going to be uploaded to our YouTube channel, which is Downtown Stockton. And if you are watching live on Facebook, then you've already found us there. But we also have Instagram at Downtown Stockton and Twitter at Downtown STKN. And Tamisha, I want to say thank you so much for sharing with us today about all of the resources that 211 can help our residents access. Thanks for sharing all about the program, and thank you viewers for tuning in. Let me just check one more time in case there are any last questions before we close out. Okay, I don't see any. So Tamisha, do you have any closing comments of anything you'd like to share before we wrap up?
I just want to thank you for having me today. Thank you guys so much for the questions. 211 is available if you think of any other questions, or if you're ever in need of anything, please don't hesitate to reach out to 211. We are free, confidential, and available 24/7. If you are a organization and would like to become a community partner, please don't hesitate to visit our website and submit an application. And if you are interested in ambassador training as far as your organization and your staff, please don't hesitate to reach out as well. We want to make sure that everyone is aware of 211, and we are coming together for our community and making sure our residents are served with the services that they're in need of. So thank you all.
Amazing. Thank you so much for your time, Tamisha. And thank you so much, viewers. And with that, I would just like to say, have a great day downtown. Thank you.